This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, and let us know when we should get started.
You guys are good to go. I'll give you a heads up when you have 5 and 2 minutes left.
All right, perfect. Hi, my name is Jake. I'm one of the PGY4s and one of the chief residents, and we also have Clara on, who's our other chief resident, here presenting for UCI's PM&R program. So here are our residents here. We have 5 residents per class, 15 total, and all of these are going to be advanced positions. We do have a prelim medicine year available through UCI that you would be applying to separately. How many people go through that program each year really varies. It can be 0 up to 3 of the 5 residents end up going through that prelim medicine year. So here's some of our faculty. Just giving a little background Dr. Han is going to be our chair. He was our previous program director. And then Dr. Ye is going to be our PD for the program. I can't speak highly enough of how much she advocates for each of the residents in the program and how much time that she puts in. She definitely works harder than any of the residents in our program. We have our vice chair, Dr. Creamy, who's also part of the pain department. She's a great resource for anything PM&R, very connected throughout the nation and many different organizations. And then our assistant PD that just joined us, Dr. Chavez, a recent graduate, and just went through our SCI fellowship at the Long Beach VA as well, too. And then some of our outpatient more so attendings, Dr. Corey, and then Dr. Majors. Dr. Majors does both inpatient and outpatient, and he had done a previous sports and spine fellowship. So this will be our core faculty at the UCI main campus. At the Long Beach VA, we also get to work with Dr. Ko, Dr. Lee, and Dr. Bedell, who would be with our PED service. And we'll talk a little bit about their services more as we get to our rotation breakdown. Some other faces at the Long Beach VA, we work with these 4 attendings, and then we also work with a few others that are more recent hires at the Long Beach VA. These are going to be our clinical professors at the Long Beach VA. All going to be outpatient. Dr. Tran doing our EMG training, Dr. Barrowade both with pain and with MSK, and Dr. Kiner being more of our MSK training. We also have our SCI attendings here, just so you see some faces. And then we have a lot of research faculty as well with UCI that are doing a lot of clinical, benchmarking clinical work that can definitely be an opportunity to join along with. So some of our rotation sites, we're spread out through Orange County, working through some of these here. We have most north, the Long Beach Memorial Hospital, and then we have the Long Beach VA. Out in Orange, we have the UCI Medical Center, where our current ARU is located in some of our outpatient clinics. And then down here in Irvine, we have our new UCI standalone rehab facility, which is being built right now. We'll talk about a little bit. And then the new UCI hospital location and outpatient clinics just off Jamboree down in Irvine as well, too. So each of these, I live down about here, and it takes about 30-ish minutes to get all the way up to Long Beach, generally going opposite traffic, driving north to south. Residents live throughout this whole region. Some live in Long Beach, some live in Orange, some live kind of in the middle. Just really depends on where you find a good deal and a place that you like to live. So our academic curriculum, it's mostly going to be outpatient focus. We have 10 or 11 week rotations for the year, and there'll be 5 of these. It works out to being about 20 months of outpatient time, 12 months of inpatient, about 10 weeks of consults, and then 4 weeks of electives. And these rotation sites are going to be at that UCI Medical Center where we have our main ARU, Long Beach VA. Long Beach Memorial, and then the new sites down here. What's really great about this program is that you rotate at, a lot of different, you rotate an academic facility where medical center is at, VA, so you get to see what the VA medicine care is like, and then also at Long Beach Memorial, which is a private hospital. There is a big difference between each of these sites, so it's nice to kind of get a feel what you like before going out into the real world and looking for a job. So here's a very grainy picture of what our new rehab hospital is going to look like. Expected to open in 2025 or 2026. They broke ground, a few months back, so it's currently in the process of being built. Same architecture as UC Davis's standalone rehab that was built recently, so it's nice to have their experience as we're going into opening our facility as well. It's going to be a 52-bed inpatient rehab facility, standalone, going from our 14-bed inpatient rehab at the UCI Medical Center right now. So it's going to be, a great opportunity for increased inpatient care and training. I'm expecting to have, more of a dedicated SCI, TBI, and general rehab services. Looking at the other UC Irvine Hospital campus that's just being built right now, we have the Joe C. Wen Center for Advanced Care, which just opened up about a month or two ago now. And this is the new site of our outpatient pain rotation, which we rotate with primarily with the anesthesia folks on our campus. They also have a pain fellowship there that accepts 4 per year, and more recently taking more and more of the UCI PM&R grads. Very busy pain clinic, get a lot of experience with different procedures and head-to-toe pain care needs. In addition, there'll be a 144-bed inpatient hospital that's opening down at that site as well too, with the focus on oncology, neurology, neurosurgery, orthopedics, and digestive health. So a lot of different things that are rehab focused, and likely will be those patients that will be servicing over in our acute rehab units as they need it. Other new aspects of UCI, a lot of new things this year. So they also acquired 4 tenant hospitals in Orange County recently. Close to $1 billion deal, which added 858 inpatient beds to UCI. Our previous hospital being about 300 to 400 beds, so more than doubling. And in addition to the new hospital that's being built, there's just a lot of new growth and opportunity with UCI. How this affects the residency, I don't expect large change with these new hospitals that are recently purchased. And their outpatient pavilions included. But, for those going through, looking to stay in Orange County, likely to have increased opportunity just when graduating, which is kind of something nice to keep in mind. So getting into our academic curriculum, we have the PGY 2 year. It's going to be, you start with your MSK early on, which is nice. Inpatient is sprinkled out between your 2, 3, and 4 year. Your UCI general inpatient is going to be that acute rehab training. So manning about 14 or holding 14 patients generally max for that. Long Beach Memorial, we have another inpatient ARU experience where it's focused with SCI, rotating with one of our SCI trained faculty. And this is Long Beach Memorial down here on the bottom left. You get early exposure outpatient at the Long Beach VA doing our MSK clinics. You get a lot of time just head to toe MSK complaints coming in, getting a lot of the procedures early on, which is nice. A lot of knees, a lot of shoulders, hips as they come in, both blind and with ultrasound guidance, depending on the attending that you're with. At the Long Beach VA, we also have our SCI outpatient rotation, and this is going to be learning how to provide general SCI care in the outpatient setting, and you also get some MSK time in there as well too. A lot of great didactics during that rotation, learning about bowel bladder management and anything else related to SCI. After that, we have our UCI research outpatient rotation, which is highlighted here. So there's 2 different versions or flavors you can get of this, depending on the research track that you focus on. There's a clinical focus track, which is track 1, where you have 1 day of research time per week allotted in this block, versus track 2, which is more research focused, and you get 2 to 3 days of research per week. In this, you complete your badges project, which we'll talk about briefly, and then you get to rotate through a lot of different clinics, which is really helpful, especially as a PGY2. You get to see general outpatient PM&R, some orthopedic surgery, sports medicine, some EMG, early exposure. MSK radiology, you get to hang down in the basement and read out with some of the MSK radiologists, which is super helpful when you have x-rays or things you need to read on your own, or MRIs. Some spasticity exposure, amputee clinic, and then we have ultrasound self-directed learning as well during that time. So this Badges project is something that was developed back in 2011, and it's recommended by the AAP, nationwide as an introduction to research. So it's a self-directed curriculum to help residents feel prepared and confident, reading and applying scientific literature, conducting research, and writing high-quality manuscripts. This is an opportunity to kind of learn how to, develop research projects and to, get some research in yourself. In the third year, we have our pediatric inpatient rotation. It also has some outpatient time as well, too. I get to work with Dr. Bedell, which is a very known in the pediatric rehab world in this area. You also have UC Irvine General Inpatient Consults, which is a great mentoring opportunity where you work with a PGY2 on the ARU, and you also get to do some consult time as well, too. UCI Center for Pain and Wellness. So, if you're interested in pain, we always arrange to have pain exposure before you have to apply, which is early in that PGY3 year. Very busy service. You get a great exposure, great training. They push you, but you get a lot out of it. And then you have elective time that you can take, either doing an extra 4 weeks in pain or in any other electives you like to see fit. And then we have a PM&O and MSK rotation at the VA where you get to learn about prosthetics and orthotics a little bit more. And then the EMG block, your first EMG block in your PGY3 year. Generally no problem hitting your EMG numbers, generally getting probably about 250 to 300, depending on how well the patients are showing up at the VA. PGY4 year, you go into outpatient consults, and then you also have Long Beach Memorial doing another inpatient ARU rotation on the private practice style, which is good to see before going out in the real world. You also have Long Beach VA doing a pain rotation with some MSK, and then another MSK EMG block that you do twice throughout that PGY4 year. It's nice to get to mentor some of those trainees on the EMG side of things as well, too, because you work with the PGY3. So I'll turn on over to Dr. Yeo for the call schedule. If you have any questions, feel free to chat me in the private chat or in the group, and I'll try to message back as she's talking here.
Hi, everyone. So I'll get started with the call schedule. So for PGY2s, it's a 10 weeks of home call where we cover the UCI ARU, which is a 14-bed unit. The PGY2 will have to answer pages from 5 p.m. to 7 a.m. They have to do weekend rounds on the ARU patients and also consults. It gets easier as a PGY 3 and 4. We cover 5 weeks of home call per year and cover the Long Beach Memorial site as well as the PEDS ARU at Long Beach Memorial. The census is usually around 18 to 25 patients. And once more, you answer pages from 5 p.m. to 7 a.m. and you do weekend rounds on the ARU patients, and rarely do you get consults. Something we try to set up, especially for the PGY2s in the beginning of the year, is to create a buddy system. So if a PGY2 is on call and they have any questions, they could reach out to their senior on call to field any of their questions. Next slide. We also have didactics once a week on Thursdays from 1 to 5 p.m. and we follow a 12-month schedule. We have both a mix of in-person and Zoom didactic sessions. In the bottom right corner, you can see our annual aquatherapy didactics that we have at Long Beach Memorial, led by one of our physical therapists. Next slide. For procedures, we have a wide array of procedures that are done at both the VA, the Center of Advanced Care, LBM, and UCI in orange. And the procedures include peripheral joint injections, trigger point injections, EMG, peripheral nerve blocks, epidurals, facet and SI joint injections, Botox for both spasticity and for headaches, programming and refilling baclofen and opioid pumps. That's mainly done in the PEDS and also in the pain clinics, as well as peripheral nerve stims, genicular nerve block, and RFAs. UCI also provides a very competitive salary, which includes a housing stipend that's incorporated within the salary. The UC residents are contracted to be renegotiated at the end of the 2025 year with the union, which continually advocates for increased salaries. Next. Benefits include time off, 30-day maximum per year per ABP-MENAR requirements, which is 20 vacation days and 10 sick days. We also receive an additional stipend or fund per year, which includes a $1,500 educational fund and 120 meal allowance per month while on the rotation at the UCI Orange location. We also have licensing fee reimbursement and free parking at Long Beach VA and Long Beach Memorial. So where do our graduates go? The next two slides indicate that in the past 8 years, there were 3 ACGME sports matches, 4 sports and spine matches, 12 pain matches, 1 PEDS rehab match, and 2 SCI matches. So you can see that many of our applicants are interested in pain and spine. Our program supports our residents by providing a lot of exposure to pain throughout our residency experience to help them achieve matches into competitive programs. But that's not to say that if a resident shows interest in other subspecialties like TBI, SCI, sports, or PEDS, our program will also be supportive in helping them gain exposure to that as well.
You have 5 minutes remaining.
Thank you. So some popular cities include Huntington Beach, Long Beach, Irvine, Costa Mesa, Newport Beach, Orange, and Anaheim. Costa Mesa, Newport, and Irvine all have very nice malls if you're into shopping. And Irvine, Anaheim, and Westminster have really good Asian food and boba if you're into that too. Next slide. Other attractions include theme parks like Disneyland, Knott's Berry Farm, and Universal Studios. Disneyland is especially close to the Orange campus. And other attractions include our beautiful beaches, including Long Beach, Huntington Beach, Newport, and Laguna Beach. And there's also Catalina Island that you could try going to over the weekend. It's perfect if you love surfing. I personally don't surf, but I love snowboarding, which is very close, like maybe a 2-hour drive to Big Bear. So that's also doable. Only in California can you do both surfing and snowboarding in the same day. Next. And if you're into sports, we have the Angel Stadium in Anaheim, where a lot of our residents actually live very close by to that stadium. And you also have access to the LA Dodgers, Lakers, Rams, and more. And in terms of resident life, we have a social and wellness chair that organizes events. Especially we try to organize get-togethers after didactics. The residents also attend conferences together as well as workshop courses. And yearly we have a residency retreat. 2 years ago, we rented a giant house in Temecula. And 1 year ago, we had a get-together in Big Bear where we rented a large cabin there as well. We also have annual holiday parties. As you can see below, one of our attendings hosted a giant Christmas party in her Newport house. And we also have graduation celebrations as well. So if you have any questions, you could email UC Irvine PM&R, and you could also email Jake and I. We could drop our emails in the chat down below. And follow us on IG.